25 to 35% of female infertility worldwide is because the fallopian tubes are not open. Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Center. What's tricky is that most women have no symptoms at all. So let me explain what it is, why it happens, and how we diagnose it, and importantly, how do we treat blocked tubes. Why are tubes so important to begin with? Think of the fallopian tubes as a meeting point for egg and sperm. This is where fertilization actually happens. If the tube is blocked, swollen or damaged, the egg and sperm simply cannot meet. Even if they do, the embryo may not travel properly, leading to fertility issues or even ectopic pregnancy. So, what could be the common causes of tubal blockage? Pelvic infections including chlamydia or tuberculosis, previous surgeries like appendicitis or cesarean section, endometriosis, or even hydrosalpinx, which is nothing but swollen tubes filled with fluid. Additions also could cause inflammation leading to blocked tubes. Some women are born with tubal abnormalities, though this is rare. So, can we diagnose it? Of course we can. We can diagnose tubal blockage by a procedure called as hysterosalpingography. This is a most common used test. A dye is gently injected into the uterus and an X-ray is taken. If the dye spills out of both tubes, fantastic, they are open. If it doesn't, the tubes may be blocked. But the best part is sometimes the pressure of the dye itself opens minor blockages, improving chances of natural pregnancy. Next is SSG, saline sonography. This is a procedure which is more comfortable, ultrasound based test using saline or foam contrast. There is no radiation, it's quick and very useful. Laparoscopy also can be done with the dye test. This is the gold standard under anesthesia. A small camera is inserted into the abdomen to directly visualize the tubes. The dye is injected again. If it flows, tubes are open. This method also allows treatment at the same time, such as removing adhesions or treating endometriosis. There are treatment options for minor blockages. Let's look at those. General flushing can be done. Treating infections is important. Short course of antibiotics. Removing small adhesions during laparoscopy. For many women, this is enough to restore tubal function. For hydrosalpinx, however, the approach is different. A hydrosalpinx greatly reduces IVF success rates because the toxic fluid flows back into the uterus. Treatment options then include laparoscopic removal of the tube, blocking the tube at the base. This dramatically improves IVF outcomes. But for severe damaged tubes, the approach is slightly different. When the tubes are extensively damaged or scarred, surgery may not restore function. In such cases, IVF is the best and safest option. IVF bypasses the tubes completely. Egg retrieval, fertilization in the lab, and the embryo transfer into the uterus can be very easy ways to get pregnant. Tubal blockage is common but very treatable. Good diagnosis is essential to choose the right treatment. Many women conceive naturally after minor corrections. And when tubal damage is severe, IVF offers excellent success. If you wish to know more about this, please feel free to contact us. Thank you.